Yes, sir, we like.
A very good evening to all the students who are joining us today. Only 10 days to go before your, day of reckoning comes in. Welcome everyone. I am Dr. Sandeep Sharma, your pediatric faculty, and I am joined here today evening by none other than your favorite faculty, your favorite mentor, Dr. Rajiv Daman sir. We both are here for a purpose. At DocTutorials, we believe in holding your hand and continuing in your preparation. Of course, we can't find the battle for you, but we want to be there for you. And in case you need any assistance when it comes to planning, when it comes to preparation, that preparation part, that education part has already been done. But close to the exam, last 10 days, many of you might be at crossroads. Many of you requested me, many of you requested sir, sir, please come out with what are the last minute points we should keep in mind. What are the things I should do and things not to do in the last 10 days? Because my dear friends, it's like a 2020 match. Last 5 overs are very, very important. So similarly, we are here and welcome Rajiv Dhawan sir to this live session, sir.
Thank you very much, Dr. Sandeep, and we are delighted to have a wonderful team, including you, and everyone is very much committed to the welfare of FMGs, and we are delighted to conduct this session. And the session will be about the final 10 days, as Sandeep told, that they are very, very crucial, and we would help you out to really make the best use out of them. Sandeep sir.
Thank you, sir. Sir, let us dive right into the preparation. I am a FMG student, 10 days to go. I'm feeling anxious. I'm feeling FOMO. I start reading one subject, then I start thinking of the other subject. How should I plan my preparation over the next 10 days?
Wonderful, sir. And sir, everyone is anxious. I'm telling you, if you and me are appearing in the exam, अगर आप और मैं exam दे रहे होते, तो हम भी उतने tense होते जितने लोग सुन रहे हैं वो tense हैं. But last 10 days, two things can happen. We can just waste thinking what can go wrong, or we can do one thing: how to put best use to these 10 days and try to extract maximum marks out of that. That would be the strategy we'll be sharing. And team, can you please share the slide, please? We have prepared the schedule for last 10 days, and this is starting from 16 July. So if me and Sandeep are appearing in the exam and we are preparing together, staying in the same hostel or the PG in Gautam Nagar or in Jaipur or in Hyderabad, Chennai, Trivandrum, anywhere, and we're studying together, what is our plan to follow? So Dr. Sandeep, you know that we have been talking about pyramidal approach. The notes are very huge, humongous, and when we solve the MCQs and the PYQs, we start getting idea what they're asking. क्या पूछ रहे हैं ये लोग? क्या ज़्यादा पूछ रहे हैं? क्या ज़्यादा डेप्थ में पूछ रहे हैं? क्या बार-बार पूछ रहे हैं? What are they asking again and again? And now it's a time to only cover the high yield points. So when I say, like high yield points of, pediatrics, or ENT or medicine, what has been coming out of ENT, like angiofibroma, the glue ear, it that, every time they're asking about something about the middle ear or something about the, the laryngeal carcinoma or similarly pediatrics also, it. So, for example, the subject would be vast now, but only critical high yield data points to be touched upon. And let me start from 16 July, sir. So 16 July, Dr. Sandeep, which is tomorrow, and everybody please invite your friends also so that they hear it live, and they are committed that if you do not have any schedule to follow, if you do not have any timetable to follow, and you're clueless right now that what to do in these 10 days, we do not know, then you can use this. But if you have your own plan to follow, please stick to that. That's not a problem. But अगर आप बिल्कुल अभी इस समय भटके हुए हो, एमलेस हो कि भाई करना क्या है 10 दिनों में, डर लग रहा है, वो तो समझ आती है बात. लेकिन अगर हमें कोई एक डायरेक्शन देता है कि ये 10 दिनों में ये कर लो भाई, तो बेस्ट पॉसिबल हो जाएगा. And Dr. Sandeep and me have designed this schedule in such a way that, we are keeping the more forgettable things towards the later part of preparation. And we have kept the scope of one grand test also. We have kept the scope of your travel also. That's what. We'll go till 25th July. Let me start on 16th July. Everybody note down. The first part will be anatomy part 1. When I say part 1, please do not do upper limb, lower limb in this actually. Just do anatomy, GIT, genitourinary, thoracic, head and neck neuroanatomy, and in 4 hours, and surgery in 6 hours. So Sandeep sir, you and me, if we are students, हम कैसा दिन बनाएंगे? we'll have 2 2-hour sessions. 2 2-hour session and 5 such session of theoretical revision. And every day you must solve 50-50 question, 2 modules at the end of the day or in between the day when you want to take a break from the theoretical study. So everyone please make a mark. This actually is a 10-hour schedule per day. और हर दिन में 10 घंटे की थ्योरेटिकल रिवीजन की बात की जा रही है, लेकिन 2 मॉड्यूल every day you have to do custom modules of 50-50 question each. Make assemblage of all subjects, little high difficulty level, और वो तो हर डे करने ही करने, every day please mark. So in 8-9 दिनों में 800-900 question we have to see again, but keep the difficulty level little higher for that. Make custom module of different subjects altogether every day. Now 16 July anatomy part 1, 2 sessions, mean 2 hours, 2 sessions devote to everything in anatomy except upper limb, lower limb. And then surgery, 3 sessions, 2 sessions, surgery in 6 hours to be finished. So first day we are devoting to anatomical part of the general surgery also, and the surgery as a subject, which is a very high yielding subject. Now July 17th will be like anatomy part 2, upper limb, lower limb. Let us do upper limb, lower limb in the morning, and then in 2 hours let us do the orthopedic. So anatomy part 2 is 2 hours. 2 hours is 1 unit of study, and orthopedic 1 unit of study. Let us do first tumors first. Everybody do tumors first. You always forget the tumors revision, and tumor give you straightforward marks. And then we go to the fractures. Actually go to the high yield now, Garden classification, Salter Harris. You know what they're asking actually. Okay, fine. And then we go to pediatrics, sir subject, very very scoring subject. Last time it was like the lucky draw for the people who read the pediatrics from Sandeep sir, and close to 22 questions of pure pediatrics, and 17 out of them approximately was scoreable if you have done doctoral videos of Sandeep sir, and it was a really really very magnificent score in pediatrics last time. 2 hours devote to pediatrics, and I'll ask Sandeep sir also for some tips of pediatrics later on. Microbiology 4 hours. Everybody's scared of microbiology, I know that, but let us devote 2 hours to bacteriology. Please give 2 hours to bacteriology and remaining microbiology into. This is a time to go high yield, not about becoming emotional. You're emotional mycology, but mycology would not yield those many questions. You know that, okay? So just look at this July 17th, everybody. So 1 unit is 2 hours. It means that anatomy devoting 1 unit, orthopedic 1 unit, pediatric 1 unit of study, and microbiology 2 units of study. Actually, this is 10 hours. And every day, don't forget to do custom module of every student together, 50-50 question each. July 18th now. Pathology 6 hours. Why? I have given all major subjects 6 hours, like pathology, pharmacology, PSM, gynae, surgery. Everything is 6 hours. See. Now, please see pathology 6 hours and IENT 2 hour, 2 hour each. So just you can split like that. Pathology, you did the systemic pathology in like maybe you reviewed in 2 hours. Now you can take IENT and then do general pathology at the end to just add flavor to the day, actually, like that. Again, don't forget to 100 questions every day. Okay, so these are first 3 days. Now, next slide would be about 19 July. Actually, please keep noting down. Physiology comes 4 hours. Why is physiology? Cardiac physiology, respiratory physiology, and the kidney physiology. And after that, you do the medicine, CVS, CNS in 4 hours. So I divide medicine in 2 parts. Again, medicine 6 hours. But today with the physiology, it's easy to take care of the CVS, CNS in 4 hours and forensic medicine for 2 hours. So I repeat, July 19th is about physiology, then medicine, CVS, CNS. Give CNS, CVS, 2 hour, 2 hour each. And don't forget to revise the, basic critical data points, like for example, the ECG part, the Parkinsonism, the multiple sclerosis. You should always target the cardiomyopathies. You must always corpus pulmonale, which ECG coming, like that. This time to just see high yield. Okay, fine. And now please see, when you do, physiology 4 hours, cardiac cycle, and then you CVS revision also, the synchronization. So this schedule we have decided in a very, careful manner so that there is maximum output every day. Forensic, please keep sanitized 2 hours, and it is sometimes a very scoring subject, let me tell you. Now, next day, July 20th, Dr. Sandeep will do obs gynae 6 hours. So I'll say, give a little bit more time to ops, it, but gynae, again, some topics are very, very important. So 2 hours you can give to gynae. Derma psychiatry is 2 hours, derma and psychiatry 2 hours. And now medicine part 2 is coming. In medicine part 2, we are doing what? We are doing majorly, first of all, the respiratory physiology, the medicine, and the nephrology. And please don't forget to see quickly endocrinology. People say it's smaller subject, but endocrinology can really give you wonderful score, I'm telling you, because there are set questions coming, it. So in this 2 hour, I give you complete liberty. Dr. Sandeep, your take on this actually, like endocrinology,
Sir,
rheumatology,
endocrinology, sir, endocrinology is like Rishabh Pant. He will play
okay.
either a horrendous shot and get out, or he will take the bowlers to cleaners. If
Yeah,
if you look at the past papers in medicine, there have been exams where only one or two questions were asked, and there have been papers, including a couple of years back, couple of papers back, where almost 7 to 8 questions were asked. I remember that last to last exam, there was two questions from diabetes, one question from oral hypoglycemic, one from Addison disease, one from pheochromocytoma. I have a list in front of me. That is why I'm saying with confidence. There were one question from adrenal disorders, not related to this. It was a more of a generalized condition. One was a Cohen syndrome, and another was a Men syndrome. So you had about 7 to 8 questions from endocrinology. Somebody had read only the important topics, the student would have done great. But
yeah,
somebody had done entire medicine and left endocrinology, again, it would have been
yeah,
disastrous. We don't know what will happen, sir, but
yeah,
I
true.
think endocrinology, along with cardiology, nephro, and neuro, needs some attention.
Definitely. So that's why I said 19 July, I kept 4 hours for CVS CNS. Like 2 hour you do CVS, 2 hour you do CNS, fine. But next day, again, remaining part of medicine, as sir told, why not really touch upon the main points of endocrinology and nephrology on the second day. So look at the schedule, Vijay. I'll just like to take you this one, that if 16 July was anatomy part 1, 17 is anatomy part 2. Yeah, so there is a coherence coming over there. And if you see the July 19th, physiology, if you're revising in the morning, you're revising the CVS in the afternoon on that day. So there is a high chance, because medicine subject is like that. You don't know the question came from physiology or medicine or pharmacology. You know that. Okay. So this is July 20th over, sir. Dharma secretary, please. Dharma is again a scoring subject. And if you would send Dr. Pallavi's, content over there, and you can always do one thing. If you have missed upon any subject right now, bache, any subject you have missed upon till now, and you think I'm not really sure what to revise, that's why the quick revision videos, QRP videos, HIT, particularly HIT, we did FMG, the high impact training program for the FMG July 2025. It has got the premium content in the lesser number of words for the upcoming examination. Anybody has missed any subject, please go to our app and just do the HIT content, high impact training content of that subject in the given number of hours as per the schedule. Also, believe me, it would cover the major data points of that subject for you, and you'll be able to score maximum possible on that day out of that. And let us go to July 21st, PSM 6 hours, for example. PSM 6 hours, I just give an example. By chance, you have not been able to touch PSM. There are some students who came very late, and they are not able to do the classes, and they have not been able to do PSM as a subject altogether. You just go to the app and see the HIT program of Dr. Rajasi over there for PSM, and she has summarized the subject in 4.5 hours. Major content has been covered over there, guys. And the biochemistry 4 hours. Priyansh is there, and a wonderful content by Priyansh is over there in the HIT. And if whatever content you have is like, this HIT is only for those subjects where you think you have not been able to really do that subject actually. So that is there. But if your content already with you, revised biochemistry in 4 hours, very scoring subject, guys, please look at it. We have done the anatomy, physiology, biochemistry of the first prof, which is a major content of paper 1. We have also covered the microbiology and pathology out of paper 2 also, and forensic medicine also, it. And July 21, when you do the PSM biochemistry also, PSM is majorly asked in the paper 1. Paper 1, if start giving a feeling that out of 3 blocks, 2 block go well, you start getting this feeling that, okay, paper is on the right track. Nobody will be able to crack the whole of the block, I'm telling you. मैं पहले ही बता रहा हूं आपको, वहां आप ये प्रूव करने नहीं जा रहे कि मुझे सब आता है, वहां आप ये प्रूव करने जा रहे हो कि मुझे sufficient level of knowledge है to start practicing as an intern in the country. So ऐसा dishearten नहीं होना है. 3 में से 2, 1 block tough आएगा. Last time INICT also, first block was very tough, and a lot of people got derailed out of that only. And this is the mindset we'll talk about again with Sandeep sir about it. But After July 21st, let me take July 22nd. Pharmacology are given 8 hours. Dr. Sandeep, you might be saying that, Dr. Dhawan, why pharmacology 8 hours, guys? My always this concern is that, pharmacology people study, they revise, they forget. They revise, they forget. So 8 hours, why we are kept for pharmacology on 26nd? Because we are very close to exam now, 26th exam, and 22nd in 8 hours, in 2 hour, 4 sections. If you are able to really revise the critical points of pharmacology, most important thing is you'll get confidence to crack the exam in a big way. This because your fear is pharmacology or medicine. You know, pharmacology 8 hours 22 July को दे देते हैं. That would be, and breather anesthesia radiology in 2 hours on that day. Okay, so you can do some half of pharmacology first, then you do anesthesia radiology in 2 hours, then remaining pharmacology in the later part of the day. But don't forget again, 100 questions every day must be done. Dr. Sandeep, 23rd July we have kept for the grand test, and this is full mock. And the last grand test of yours ever would be 23rd July. Do not give test on 24th, 25th. It might be detrimental because grand test scores do not have direct correlation with the exam, real exam score, because somehow grand tests are a little bit more difficult than, or they are like little bit higher level, and you can say that our revision is not complete, our last revision is not done, and we always get like 148, 139, 156, 163, and we have a worry that, will it be able to really pass the exam or not. My humble suggestion to everyone is, grand test means training the brain session. You are going to appear on 26th July in the final exam. Let us live 23rd July exactly same day. Guys, please convert 23rd July as a simulation day of 26th July. Get up at the same time, eat at the same time, take a break at the same time, and do the question also exactly on the same time when the real exam will be happening. Dr. Sandeep, your take on this actually, the grand test, how, like simulation would help the students on that day.
So simulation, I always give the example. Like, have you all seen, you all have seen, right? Uh, when there is an important match, players would come onto the field. I'm giving a cricketing analogy so that you can understand it better. That players will come on the field, they would be jogging, they would be hitting, the bowlers will be bowling, and they would also show that, toss is happening and Virat Kohli or Rohit Sharma or Rishabh Pant, they are in the nets or they are on the side hitting the ball. So are they learning something new? The answer is no. It is just that our mind, our body, and our whole system works in a certain way that there is a thing called as flow. If you are solving MCQs, if you are solving a complete exam kind of a simulation 3 to 4 days before the exam, and you are regularly solving MCQs, your brain gets into the habit of looking at the question, grasping the keyword, and using the keyword, reaching the correct answer. Your brain gets into the practice of ruling out the options. Your brain gets into the practice of looking at all except, none except, all are true, which of the following is not true. Those not true kind of things, those silly mistakes are made by people who are, number one, either not having enough revision, number two, they are not having enough MCQ practice. So getting that MCQ practice gets your neurons going. See, you need to understand one thing. You have read everything. You have read multiple times your workbooks or your notes. You have gone through them innumerable number of times. You may right now think that I don't remember anything. But when you sit in the exam, things will come to you. When will they
Yeah.
come to you?
Yes.
Only the only catch is your brain should be in topmost level of solving MCQ. It needs to get into that mode of solving MCQ, and this is where grand test comes into play. At the same time, if you solve a grand test and there was a topic which you knew that okay, I know very well about it, but that question you were unable to solve, it will make you go back to your notes and revise that table itself. So more than the grand test score, it is the process of giving grand test that is important. And
Absolutely.
lastly, if you are given a grand test, you will not panic. It would be, your mind will be like, abhi to kiya 4 दिन pehle. Your mind will actually take the actual exam as another mock. It will, the anxiety level will fall by at least 10 to 20%. So please go by our words. If you can't trust yourself, go by our words, and
Yes.
please solve MCQs daily. As sir said, and try to give one grand test at least before you sit in the exam, but certainly not, as sir said, on 24th and 25th. Over to you, sir.
Yes, absolutely, sir. Grant tests, everybody. I will take 1 minute. Wonderful suggestion by Sandeep sir. You know, आप ग्रैंड टेस्ट दो, आप चिंता मत करो कितने नंबर आ रहे हैं. लिव दोस 300 क्वेश्चंस एग्जैक्टली द सेम वे, because exam is on 26th, 23rd your practice. Live the same style day. Wear the shoes, sit down on a chair, don't take a break, don't go to the washroom, don't roam around here and then, look around also. Brain एक बार train हो जाता है. Now everybody please write down this word. पूरा पेपर किसी को नहीं आता होगा, let me tell you, but you know sufficient enough to pass the exam, and much more than 150 can score. Only thing is, look at us not as faculties, look at as that people who have passed through these processes multiple times, and we have seen that in the exam knowledge एक चीज है, ज्ञान एक चीज है, ध्यान भी बहुत important है. Paper is not just ज्ञान only, paper ध्यान भी है भाई. Paper is साम दाम दंड भेद, everything is required for the paper day. सिर्फ आप नॉलेज की बात करते टेंशन हो जाता. What is your brain right now telling you? Let me guess that the brain is telling you मेरी पैथो में सिस्टेमिक पैथ वीक है, मेरी फार्मा में मैंने सीवीएस सीएनएस नहीं पढ़ा, या मैंने जनरल फार्मा छोड़ी हुई है, मैंने माइक्रोबायोलॉजी में इम्यूनोलॉजी रिवाइज नहीं किया. योर ब्रेन इज एक्चुअली टेलिंग यू दोस काइंड ऑफ लैकुना इन योर प्रिपरेशन. एंड लेट मी टेल यू वन थिंग, बट योर ब्रेन इज नॉट रिमाइंडिंग व्हाट योर जनरल पैथोलॉजी इज मच बेटर. Like your bacteriology, you're done this time, good. Like it has been revised. In like in physiology also, you have left maybe like this neprophysiology, but you've done the cardiac and the CNS physiology much better. Just look at the positive. Like हारे हुए मन से पेपर नहीं देना है हमने. मैं बार बार बोल रहा हूँ, this is a time to feel upbeat about your preparation, and the license to feel upbeat about preparation does not come when you're 100% prepared for the examination. License to feel upbeat about your preparation will also come from where you started and where you are today. आपने कहां से शुरू किया था जब आप आए थे इंडिया में, वो कहां पे थे, where you were and where you are today. There is significant improvement in the knowledge. You know it, but yes, 100% nobody knows. Medical science वो महामाया है जिसको कोई पूरा ना जान पाया है. Nobody can know the medical science fully. That's not an obligation on you. पर हमारा दिमाग हमें हमारी कमियां दिखाता रहता है. That's you're scared of. That's why grand test is very, very important. Cutoff date is 23rd. Now every 24th and 25th July. Please see, 24th, 25th July, travel should be done on time. Everybody, please, now we'll talk about the exam day strategy also in this session only. But you know what? Travel should be planned. If you are staying in Jaipur and your center is in Bikaner, please do not travel on 25th. Do not try to save money now of 1 day hotel fee. Please do not stay at the relative's place also, because the relative will keep asking you, pass to ho jayega, padhai tune kari hai ki nahi kari hai, those kind of things, and this will create undue anxiety. Stay away from everyone. And please, if your travel distance, Delhi, Noida, understandable. Delhi, Ghaziabad, understandable. Subah hi jaane, koi baat nahi. Maybe Jaipur, but Alwar, maybe 1 day. But farther places like that, एक दिन पहले जाने में कोई हर्ज नहीं है. और एक बड़ी इंपॉर्टेंट बात, आप होटल में रहने वाले हो, अगर आपने 25 जुलाई को उस कमरे में पहली बार रहा और उस कमरे की कूलर की आवाज में आपको नींद नहीं आई, you could not sleep on that night because the cooler was creating unnecessary noise on that day, तुम्हें एंजाइटी हो जाएगी, भाई पता नहीं कैसे होने वाला है. 24th July, acclimatize yourself. If your the city center allocated to you is farther from you, it's good to travel on 24th, stabilize yourself, and on 25th just stay in that place calm and keep revising. What to revise in 23rd and 24th and 25th? Images to be revised. Please understand, carry your books along. Which images? First of all, pathology images, then microbiology images, dermatology images, surgery images, and radiology images. These 5 images must be seen one more time, and they sometimes give good clue in the paper and they solve the question, guys. Now, staging system and tables. Everyone will forget laryngeal cancer staging, T1, T2, T3, T4, ovarian cancer, prostate cancer, like the breast cancer, so many cancer staging. And मेरे को भूल जाती है भाई, मैं honestly बता रहा हूँ, मेरे को ये एक दिन याद रह जाए, मेरी shelf life इतनी poor है इसको लेके कि मैं आज पढ़ता हूँ कल तक याद रह जाए, बहुत बड़ी बात है. But good thing is 26 exam, and we're revising this on 24th, 25th, hopefully. And there are important tables, अब आप जब revise कर रहे हो ना बच्चे, take a screenshot of that or picture from your notes of that table. Dr. Sandeep has made table, enzymatic deficiency, what are the name of disorder, what are the main features. That page of the notes, keep in that. In the last 2 days, see those images one more time of those important tables also. What is YOC? Your own choice. Everyone has some fearful subjects: microbiology or biochemistry or pharmacology or maybe surgery or maybe obs gynae. YOC is your own choice, but the cutoff time of study will be 25th July midnight 12 finish. 12 midnight, you won't study anything after that. And everyone, just mark my word, you can't get a very sound sleep on that day because tomorrow is exam. And you just lie down after 12, be off light, off device, and off gravity. The sleep on that day will be off light, off device, and off gravity. Just keep, and you will catch some sleep also. Be, let's go to the exam with a little bit rest you have taken over the previous day. Now, guys, this is the first part of this whole YouTube live session by Doctor's team. Actually, the day wise summary. July 16 is for anatomy part 1 surgery, 17 for anatomy part 2 orthopedic pediatric microbiology, 18th is for pathology ENT, 19th I'll see the physiology and medicine CVS CNS and forensic medicine, and 20th July I'll go for obs gynae, dermatology, psychiatry, and medicine part 2. Why 21st July PSM, 26 exam? And today, if you revise PSM, there'll be a lot of chance of recall on, because I've kept purposely the subjects which are forgettable in the later part. 22nd pharmacology 8 hours. Please do give that. NSA radiology 2 hours. 23rd July grand test, and 24th, 25th July we'll have the travel, and some images revision, staging tables, and your own choice of subject on that day. Now, this was the work we did in DocTutorials actually. And can someone switch on the screen now? Okay. Yes. Dr. Sandeep, do you think if you will appear in paper after 10 years of study, 10 years of study of NEET PG preparation or INI preparation or FMG examination, can you score 300 out of 300 in FMG, sir? Can you score 300 out of 300?
It cannot be done, sir. There are multiple reasons. Number one, human brain has a limitation. Even if you are of a genius level IQ, there will always be some questions where you will make silly mistakes. Even geniuses make silly mistakes. So it's okay. Don't be too harsh on yourself. Number one. Number two, examiner doesn't want that situation to happen. So every exam, there are 19 subjects. Bigger subjects, probably more. Shorter subjects, probably less. Let us take an example of my subject, pediatrics. If there are 15, 20 questions coming, just assume out of these 20 questions, 15 will be solvable, 2 or 3 will be tough, but still solvable. They will be of NEET PG or INI level. 2 questions will be there where even I would be dumbfounded in the exam. And one question will always be there, which will be based upon a journal, which will be based upon a controversial thing, which will be based upon, basically, examiner does not want you to mark it correctly. So that, see, there is no negative marking. So that question, which is atypical or which is, very, very tough, that is not going to decide your pass or fail. It is the remaining 15 or 16 questions which is going to decide your pass and fail. What we do normally is we look at the negative, we look at the tough, we forget that there will still be marasmus in the paper. We forget that there will still be CSOM in the paper. There will still be angiofibromas in the paper, right? So you need to be precise in the topics which are asked and understand that nobody, even, I'm telling you very honestly, many of my fellow faculty members might be offended by it. If all 19 subject faculty sit together and solve their respective question, they cannot get 300 out of 300. I'm giving you in writing.
A secret
On
reveal
behalf
today.
of all faculty members.
A
My
secret reveal today,
institute,
everybody.
all institutes, all institutes.
That
See,
was
because
very
there will be
honest.
ambiguous questions.
Yes.
Ambiguous questions. See, if
Yes.
an examiner puts up a question and they ask you, absent seizure, what is the drug of choice? For 2 options, you will get stuck up. Ethosuximide, valproate. Now, Harrison says ethosuximide, but pharmacology says valproate. Now, we don't know what key examiner is using, whether he's using a pharma key or he's using a medicine or pediatric key. So, you mark ethosuximide, the key was valproate and it goes wrong. You mark valproate, but the key was ethosuximide, and there is no way to know that. So live with it and understand that out of 300, 20, 30, or maybe 40 questions, will be very supreme high tough level. So every fourth question will be unsolvable. You need to understand like this. But the remaining three
Yes, Dr.
questions,
Sandeep has
they are
made a
solvable.
very big statement right now. He's saying the fact actually. He's saying what, please hear carefully. He's saying every fourth question will make you believe nahi hoga. But the important part of the story is even if you prepare for the exam for next 5 more years or 4 more years, believe me, the exam gives you this feeling only. Does INI topper have got 200 out of 200 marks? Tell me. INI topper means the most well-read medical graduate of this country. Do you think he's got a 200 or 200? No, close to 139 question even he had no idea about. Guys, मैं दोबारा छोटी सी संदीप से मैं बात ऐड कर रहा हूँ आपको 3 type of question आते हैं एग्जाम में टाइप ए क्वेश्चन एवरीबडी नोस फॉर एग्जांपल 12-year-old male child with nasal mass with profuse epistaxis. The world knows it's angiofibroma. On that day, please do not really behave weird on that day. Don't mark inverted papilloma or rhinosporidiosis on that day because that is something they're going to test you on that. Choices will be inverted papilloma also, rhinosporidiosis also. But young boy, nasal mass, epistaxis, always guys, wahan jab jana hai. Now please see, now 12-year-old male child with nasal mass, profuse bleeding is angiofibroma is type A question. I can make this question type B, like same story asked in a little different way. For example, let me give example. An 18-year-old adolescent male presents to ENT OPD with a history of recurrent perfuse epistaxis. On nasal endoscopy, a pinkish mass is seen in the choanal area. The patient does complain of the doubling of vision and the conductive hearing loss on the right side, and the voice quality is rhinolalia clausa. On clinical examination, there is a cheek swelling noticed, which is 3 centimeter to 3 centimeter in size, firm on palpation. What is the most likely diagnosis? Again, angiofibroma only, na? Again, because angiofibroma is known to enter the eye. Young boy is there, nasal mass is there, bleeding is there. Please stick to angiofibroma. This is where the secret path to passing exam is concerned. If you are going there to match word by word with your notes, then we end up changing choices. आपको शब्दों को शब्दों से नहीं मिलाना है, आपको भावनाओं को भावनाओं से मिलाना है. You're not going there to match as word to word. Nobody has read your notes. No examiner knows even that these notes exist on the planet. But they know the same science which you know, but the style of asking that science will be different. A professor from PGI Chandigarh of pediatrics would ask the same story in a little maybe floral way, ornamentally, better way, maybe, and maybe adding some rare feature to the main clinical story also. But we end up changing choices. Two main reasons of people not able to getting 150 score out of this much study is that number one, silly mistake. मतलब पता है एंजियोफाइब्रोमा है, लगा दिया इन्वर्टेड पेपिलोमा. Number two, overthinking in the type B question. Like overthinking. नहीं यार, young boy, nasal mass तो ठीक था. अब कुछ खुराफात बनाए. Because two options you have. You behave like MBBS doctor, you mark angiofibroma. But if you behave like skull-based surgeon on that day, you will mark nasopharyngeal chordoma on that day. And there lies the problem. Let us not do too many silly mistakes. Let us not change the choices because of some extra symptom written over there. Crack the theme of the question. Crack the clinical vignette on that day. Just main theme is matching with my concept. Stick to the answer because common things are asked commonly. The rare things are asked rarely. Whenever we change the answer in the second review of the paper, we end up marking common thing as rare and we lose the mark there. Let's not do this. We know you have got sufficient knowledge to pass the exam. Trust me on this. Whatever current level of knowledge you have, if you are able to follow this 10-day schedule and to touch upon the most critical data points and you go to the exam with a positive heart over there, I think I'll make it. I don't know everything, because there will be type C question also. I'm telling you, type C question you don't have any idea about. For example, Stankiewicz sign in functional endoscopic sinus surgery is which of the following? Stankiewicz sign. You don't know Stankiewicz sign? No problem. Who has told that every question will be correct out of ENT or pediatrics or PSM? Do you think there's a mandatory thing? No, that's not like that. But the problem is the moment you see unknown question over there, you start feeling palpitation, and these palpitation mean anxiety. It start getting, the whole problem with the type A and type B question also. We start analyzing them in a little different way, and we end up like losing marks over there. Let me say it out again over there. Whenever you see type C question, a totally new syndrome of pediatrics, a totally new clinical question of medicine, or maybe a new disorder of rheumatology, or some gynae new chromosome asked over there, no problem. Dr. Sandeep may take the permission of yours to tell everyone, whenever you see type C question, just remember our faces over there. Remember our face over there that these guys told that there will be 60, 70 type C questions, no problem. These guys told out of 6, 2 block will be ultra difficult, no problem. We are going to collectively pass the exam without negative marking out of 6 blocks. If you are on that 26 July, if you are seeing our faces 100 times also, 100 times also, you will still pass the paper. Mark my word on this. Please do not let the now hope of passing within you should be absolutely alive and kicking with a lot of prayers and a lot of hard work. These 10 days will do more hard work. These 10 days we will be touching upon more high yield point. We can't revise complete gynae or surgery, but we can definitely revise placenta previa, abruptio, the twins story, or the infertility topics, or whatever they're asking, out of labor and all that. Most critical data point, we can do that. In these 10 days, do more hard work, you will feel less anxious on the exam day. In these 10 days, you do 100 questions every day, you will feel feeling more confident to approach the paper on the exam day. In these 10 days, do one grand test to simulate the exam day, you'll be feeling more trained brain over there for the exam day also. Guys, प्लीज अंडरस्टैंड दिस. मैं फिर कह रहा हूँ, हिंदी में बोल रहा हूँ, आप पास होने के इतने पास हो ना, मैं बता नहीं सकता. यू आर वेरी क्लोज टू पासिंग पेपर. Only thing is keep your brain now in center. इधर उधर नहीं भटकना. Why this 10-day schedule? Do you think there's only schedule people can follow? Not at all. ये मेरा और संदीप से का schedule है. अगर हमारा पेपर होता तो हम कैसे पढ़ रहे होते? But this is not the only way to, like if you have a good schedule, follow that. This is for those people. More than 50% people are this time clueless. Clueless means they don't know what to do. So there lies the relevance of ours, not as faculties, as some guideposts. Okay, this is a direction, and this is the schedule to follow for last 10 days. But who will do it? Can Sandeep do or I can do? No. It's your battle. You have to fight. We can support you with the adequate armamentarium for that. We can give you the mental strengthening, but you are the person who will execute the whole story on the exam day. Guys, अच्छे warrior बन जाओ. Be a good warrior. And I always say, for me also, a good warrior, a wonderful, strong warrior is not someone who has all the arms and ammunitions and all the strengths available on the planet. A strong warrior is who knows his weaknesses, but still will play the game best on the exam day. I say, in spite of your weaknesses, play the best game on the exam day. And these 10 days, train your brain accordingly. These 10 days, keep telling yourself, I will not be knowing a lot of questions, no problem. But I will not do silly mistake. I will not change the answers. And anyway, there's no negative marking. I will be marking those questions also. And out of 6, 2 blocks are difficult, no problem. Even if paper 1 scares me, paper 2 will give me adequate number of marks, will pass it. This kind of attitude is very required, guys. People keep talking about knowledge. But my experience, Dr. Sandeep will also agree with that most probably, that strategy for the exam day is very, very important. And the biggest take-home message from my side will be that I accept that I do not know everything about every subject, but I know sufficient enough to pass the exam with a wonderful score. These 10 days, I will invest wholeheartedly to touch upon the most critical high yield points of the various subjects as per the given schedule. And I'll keep doing question and GT also one. And I think that's a fair enough story over there. Not to play, but as to perfect hai, lekin this is what I would follow. Sandeep sir, your take on
that? Sir, my take is very clear. Like it is something which I was discussing with you also. So क्या है कि देखो, a lot of students, what they do is they prepare very well, but close to the exam they stop revising or they start reading randomly. Random preparation or random reading creates chaos. Random reading creates doubt, and random reading also makes it creates that uncertainty in your mind. और वो अनसर्टेनिटी क्या होती है, वहां पर सिली मिस्टेक करता है एग्जाम में, और यू गेट स्टक विद इन 2 ऑप्शंस. So if you are only randomly reading, it is not the right thing to do. If you have a good strategy, Rajiv sir has given you a excellent strategy. मैं excellent इसलिए बोल रहा हूँ, मतलब we looked from our students perspective and this is the best we could come out. इससे better अगर आप कर रहे हैं तो most welcome, please go ahead with it. But अगर आपको लगता है कि you can incorporate elements from that, please do. Having strategy alone at the same time, आप लोग लिख लोगे, but then आप apply नहीं करोगे, तो then again it is a problem. So knowing a strategy is fine, you need to apply it also. थर्ड प्रॉब्लम क्या आएगा, व्हेन यू अप्लाई दिस स्ट्रेटेजी, आपको लगेगा कि सर ने बोला 4 घंटे में करना है, 4 घंटे में होगा नहीं सब्जेक्ट, तो पुश करना थोड़ा सा, जितना मैक्सिमम कर पाए, मे बी 5 आवर्स कर लो, मे बी 1 घंटा कम सो लो, आधा घंटा रील मत देखो, मोटिवेशन वीडियो से दूर रहो, बट एटलीस्ट ट्राई टू, इफ यू कांट डू इन 4 आवर्स, एटलीस्ट डू इन 5 आवर्स. You need to understand one thing. Last 10 days, Sandeep Maheshwari will not make you pass. It is Sandeep Sharma which will make you pass. You understand? And Sandeep Sharma is not it's not me. It's a metaphor which basically means you should be sticking to your notes, sticking to academic content and not motivation. Sir,
Yes.
Rajiv sir has, let me tell you one thing which sir might not have told you. Sir is right now in Canada. Sir is jet lagged. Sir has traveled more than 24 hours. And sir was, even during the flight and even from the, lounges, sir was messaging me कि यार ये बनाया है, इसमें क्या change कर सकते हैं. You understand? You, सर को क्या जरूरत है मुझे बताओ, बट ही इज डूइंग इट एंड ही इज डूइंग द बेस्ट ही कैन. सो यू नीड टू अंडरस्टैंड दैट वी आर गिविंग यू अ रेडीमेड प्लेटफॉर्म कि ये चलेगा, ये काम करेगा. नाउ इट इज द ओनस इज ऑन यू. यूटिलाइज इट and try to do the best you can. Even if you can stick to the schedule 80%, I'm telling you, you will be in a much better position in the exam rather than if you had not done or done randomly. So random reading नहीं करना है. Give time according to weightage, according to revision, and give GT for the sake of giving GT. Don't try to, extrapolate. There were a couple of GTs recently. I'll not take the names. Couple of GTs which were there recently.
Yes, sir.
First paper in both the GTs were very tough. So if you feel कि आपका स्कोर कम आ रहा है, सबका स्कोर कम आया है, सबका स्कोर कम आया है. So it's okay. The GTs were of the higher level, and the persons who were making GT were of probably of the view कि एक बार रियलिटी चेक दे देते हैं. It is a good thing. It is a good thing. Take it in your stride कि अगर उसके बाद भी if you have got a score of 148, 150, 152, work on that. You are very much in the game. There are a lot of people who score 145, 150, 152, and last 10 days they do wonders and directly go. I personally know one student, I will not take his name. He was 190 plus in last exam. He was 151, uska best score tha, but he was like, sir, kuch bhi hoga. Second attempt tha uska, but he said, I will not give up, sir. I will not take his name because he refused to give interview also. He said, sir, I am a very private person. So respecting that, but he's a real person. So if he can do it, what is stopping you? There are still 10 days to go. So जो आपको बताया गया है, overthink नहीं करना है, overdo नहीं करना है, and you can't read everything at the same time, you can't know everything. So there are enough solvable questions. And images का सर आपने बात बताया, images के अंदर I would say pediatrics के अंदर images मत देखो except radiology. Why? Simple reason. ऐसा नहीं कि images नहीं आएंगे, आ सकते हैं, आएंगे. मेरेस्मस फोटो आएगा, पता है मेरेस्मस कैसा दिखता है. क्वेश्चोरकर आएगा, यू ऑलरेडी नो कैसा दिखता है. जिंक डेफिशिएंसी आएगा, देयर विल बी रैश हियर, देयर विल बी रैश हियर एंड देयर विल बी रैश इन द जेनिटल एरिया. यू ऑलरेडी नो इट. मीजल्स का आएगा, ऐसा यहां पर उसके कॉप्लिक स्पॉट होंगे. एंड देन हैंड फुट माउथ डिजीज का फोटो आएगा, यू हैव ऑलरेडी सीन इट. स्लैप चिक अपीयरेंस, यू हैव ऑलरेडी सीन इट. सो व्हाट यू ऑलरेडी नो, डोंट डू इट. स्टिक टू द टफर ones, but frequently ask things. So radiology images, pathology images, surgery instrument images, those are the ones which may make an impact close to the exam. Over to you, sir.
Yes, sir. Absolutely. And seeing the image in the last part, 24th, 25th, is always going to pay you off because ultimately, ECG, flutter fibrillation, VTAC, and all that you have seen a day before, and you will be able to, attempt those questions properly, guys. Guys, before we finish up this session, guys, again, I want to remind you that, in such exam, you always feel, am I really prepared enough? मुझे उतना आता है कि पास हो जाएंगे because मेरे GT में नंबर तो नहीं आ रहे. Guys, because long journey we had, me and Sandeep in FMG segment also, apart from NEET PGI and SCT. Guys, please understand the spirit and psychology of the FMG examination. It's a screening examination, and they will always give you 180 to 200 questions which you are having the knowledge about. Out of them, some are straightforward question and some are little story made question, but topics are similar. The only thing is unnecessary creating anxiety now कि पता नहीं होगा, क्यों नहीं होगा, क्या नहीं होगा, दोबारा पास नहीं हुआ, because when we repeat we have a different kind of pressure बच्चे. Second time, third time, fourth time repeat है. और मैं ये बात repeaters के लिए एक बार बोलना चाहूंगा, ये बात अभी थोड़ा सा दिमाग को ये बोलो कि fresh way में attempt करना होगा बेटा. You don't go to the exam with a load actually that कि अगर दोबारा ऐसा हो गया तो, अगर दोबारा ऐसा हो गया तो brain तो बोलेगा ऐसे ना because हो गया, लेकिन you know we have to give command to our brain, let us go to the exam with फ्रेशनेस. व्हाई? गिव योरसेल्फ डेटा पॉइंट्स. लास्ट टाइम मैंने जीटी कम किए थे, इस पर जीटी बेटर किए. लास्ट टाइम मैंने क्वेश्चंस कम किए थे, इस बार क्वेश्चन भी किए हैं. लास्ट टाइम मैंने मेडिसिन बिल्कुल छोड़ गया था, इस बार मैंने मेडिसिन देख के जा रहा हूँ. काफी हद तक, पूरा तो नहीं देख पाया लेकिन देख के जा रहा हूँ. गिव योरसेल्फ डेटा पॉइंट्स व्हाई यू फील दैट दिस टाइम प्रिपरेशन इज लिटिल बेटर, but it is not 100% better. I'm telling you it's not 100% and there is no need to really worry about that. आप अपना खेल खेलो यार. मैं फिर कह रहा हूँ, we are together working, and why I'm saying again and again, because we trust this. हम जानते हैं कि कमियां हैं, we know there are weaknesses, but आप पास होने के एकदम पास पहुंच चुके हो. Only thing is, इन 10 दिनों में don't discuss the things with other people कि डर लग रहा है. Everybody, कोई भी बोलता है कि मुझे डर नहीं लग रहा, तो मुझे इस बात का मुझे डर लग रहा है कि तुम्हें डर क्यों नहीं लग रहा है. सच्ची बोल रहा हूं तुम्हें कि भाई तुम ये बोल रहे हो कि मुझे एग्जाम का डर नहीं, मैं तो भाई मस्त हूँ भाई, मैं तो कोई दिक्कत नहीं है, सब मस्त चल रहा है सर, कुछ डर वर नहीं है, मेरा तो हो ही जाना है. मेरे को इस बात का डर है, बल्कि कि ये क्या मतलब हुआ भाई, एग्जाम है तो डर है. Guys, Sandeep Maheshwari, wonderful person, you know, like, and but problem is, you know what, the motivation when put into the practicality reduces to 10% of what has been delivered in the YouTube video or the live classes also. You know it now. So Sandeep Maheshwari would be saying something like, but Sandeep Sharma is saying what? Please understand that. Sandeep Sharma is saying what? Ki bhai, it's okay to not know few things. It's okay not to, you know, revise, you know, the everything now. It's absolutely okay to have, you know, ignored few subjects because of the time paucity, or sometimes you don't feel like studying. Some people have a guilt actually. Last 4 महीने में मैंने 2 हफ्ते तब कम पढ़ाई करी थी. Guys, आप किसी को खोद के देख लो, हर बंदा ऐसा ही है. तुम्हें लगता है कि 120 दिन में 120 days of preparatory cycle, nobody would wasted time. Everyone would waste time here and there. It's okay. It's not that आपने तब पढ़ाई नहीं करी तो आपका पढ़ाई पास होने के चांस कम हो गए. ऐसा नहीं है. Believe me, ऐसा नहीं है. Honestly. And let us be practical. You know, let's not be motivated actually, because that word I don't understand even. So take home message now. One is schedule. If you like, follow it. Number 2, get proper direction. If you're not following the schedule, you should have a direction to follow for next 10 days. Number 3, now sleep cycle should be matched with the real exam day. Please sleep at one time, get up at one time, and preferably, you know, don't sleep after 6:30 a.m. in the morning. After that, live your day as per the exam day. Eat at the same time. Let your biochronology match with the exam day, because otherwise paper 2 will be little, you know, like you're feeling foggy on that day. And paper 2 would demand you to be more available to process the data, because paper 2 will be clinical. So paper 2 के time में means have a habit of having light lunch now. सब लोग light lunch रखो यार. लंच में सैंडविच और कुछ लाइट लो. डोंट ईट टू हैवी स्टफ. एंड अब प्रैक्टिस करना है कि आफ्टरनून में यू शुड बी मोर एक्टिव एक्चुअली. 10 days डू दैट, 11 डे थोड़ा हैबिट बन जाएगा. लास्ट डे नहीं होगा, मैं बता रहा हूँ तुम्हें, ठीक है. और एग्जाम वाले दिन 25th को हम लोग वापस आ रहे हैं. यस, वी आर कमिंग बैक. A day before we'll be coming back on most probably 25th. We'll be sharing this on this channel only. Please inform your friends. For that, one more, input from the respective faculty members. What is their, best take for the exam day strategy actually? Exam day में करना क्या है?
Not academics, not academic.
No,
the strategy,
not
the strategy.
That will be tips for the exam day.
Exam.
Yeah, we don't maybe do on 24th or 25th. We'll see on that. We'll share it, and on the same channel only. Please inform your friends also. I hope this session would have given you some insight into how to spend the next 10 days as it was planned. I hope आपको ये बात आपके दिमाग में बैठ गई होगी that we are very close to passing the paper. I hope you are clear about this thing, that everyone has got certain deficiencies, but in spite of that, will be able to pass the examination. And I last thing would be prayers. Families praying, parents are praying, then your teachers, all faculties across all platform, all institute, they do pray for you. We want you to pass the paper and meet us in the next cycle in the NEET PG NSTT one more time for the level 2. This time was in Chennai, Coimbatore. So lot of FMG past students, they were doing NEET PG over there. We want to see you there now and see yourself now doing that. Okay. So anything final, Sandeep sir, from your side?
Nothing, sir. I'll just tell the students, cut out the noise, keep it simple. Every day you get up, you have 10 to 12 hours easily available. मैंने थोड़े दिन पहले भी बताया था सर. People say, sir, time कैसे निकले? अरे time बहुत है. 24 hours, you take out 8 hours. 8 hours कोई नहीं सो रहा, मुझे पता है, but 8 hours suppose you sleep. You take out 1 hour for food and everything. 1 hour for bathroom, random thing, putting up towel outside, random things. 1 hour you waste. 1 hour you waste on what? Motivation, reels, random things, talking to friend, crying about, मेरे को याद नहीं हो रहा कि गलत डॉक्टर बन गया है ना. Those things everyone does. I have done that. You are also doing the same. So how many hours you have taken? 8 plus 3, 11 hours. 24 minus 11, still 13 hours. Suppose you waste another 3 hours in random things. You still have 10 to 11 hours. If you can utilize those 10 to 11 hours per day, just keep it simple. आज का दिन I have to utilize 9 to 10 hours of theory and 1.5 to 2 hours of MCQ custom module. If I have not done PYQ, I will incorporate PYQs in this. Or my score in PYQ is below 60%, then again I will incorporate PYQs into it. If your PYQ score is good in FMG, you can go for NEET PG or INI-CET. But if your score is already below 60% in FMG, I would advise stick to FMG and make it a mixed pack, as Rajiv sir also said. One day done. Target was finishing 2 subjects, 4 hours and 4 hours each, or 4 hours plus 6 hours. Done. Give a treat to yourself. Watch 10 minutes extra of reels. Watch 10 minutes of extra motivation. Sleep off. New day starts. New day again. It's a challenge for you. Take it one day at a time. And 1 week later, you will find I'm much better off today. And you अंदर से आवाज आएगा कि हो सकता है. But again, eventually you have to perform in the exam. So positive mindset, not falling prey to outside temptations, outside distractions, and doing what is needed. That is your test of character right now. So that is the most important thing, sir, that I would advise from my end.
Wonderful. The last thing from my side will be one message for the fresh first timers that हो जाएगा, इस बार हो जाएगा, इसी बार कहानी खत्म हो जाएगी. Very important for the repeat people, guys. I understand. Don't think about the parental pressure, family pressure. That what if this goes wrong? What if this goes wrong one more time? Actually, I know that kind of fear is within you. Approach the exam with more, like freshness over there. हम वही गलती बार बार कर रहे हैं. अगर आपका रिपीट एग्जाम बार बार नहीं हो रहा, कुछ गलती हो रही, we are number 1 changing too many choices. Number 2, silly, like errors over there. Number 3, time management is still a problem. And number 4, we are going there with a defeated mind. Actually, yes, कोई भी लड़ाई ऐसे नहीं लड़ी जाती है. Go there with the mind that, no, this time I'll be able to do that. That kind of mindset is very much required. And the first time also, you have done adequate, study. Is that whatever you could have done, you've done that. सबने time waste किया. Everybody has wasted few number of days. उसकी कोई problem नहीं है. It's okay, no problem. जितना पढ़ाई करना था किया हुआ है. अब ये 10 दिन अच्छे से लगाते हैं और आगे बढ़ते हैं. और हम दोबारा मिलेंगे on 24th, 25th. For the exam day strategy and tips on the same channel here only, with the lot of other faculties will be having all the doctors team. And again, I would suggest everyone that this schedule, now sit down and see whether it helps you or not. And if it does, then please write down, follow it word by word. Go faster, high yield. You can't give 8 hours to microbiology, you know it. 8 hours for pharmacology, you know it. Pharmacology will be, like having, touch in, like 30, 35 questions, know it. In medicine, in the pure pharmacology, like some in pediatrics or the pharmacology there, you know it actually, like, so we can't really ignore, like, and पूरा माइक्रोबायोलॉजी कौन पढ़ने को बोल रहा है यार? Main thing, content, like again the culture, which is like type of like appearance, the culture, those kind of things. उससे क्या होगा, confidence आ जाएगा कि मैंने जो भी पढ़ाई करी अभी तक मैंने वो देख ली है, hopefully याद भी आ जाएगी. This is what actually we want to do. So thank you, Sandeep sir, for moderating the session also, and for your valuable inputs for the timetable and schedule. And I am always always feel myself very lucky to be having so many members in the doctors team who are actually committed to the welfare of the foreign medical graduate, and we want you to flourish, like that's what. And this exam is crucial, but we are together, fighting together, and we'll make it happen together. And we pray for your like success in the exam, but keep working harder. Okay. Thank you very much, Sandeep sir. Thank you everyone.
Thank you, sir, for your time. Thank you, everyone. And in case you still have doubts, personalized doubts, please shoot at us. If we are not able to reply, you can spam a bit, but at the same time, you need to understand that we'll try our best to reply. See, 90% questions, you know the answer yourself. You know the answer yourself. Somebody was asking me, sir, पूरा surgery करूं 10 दिन में या सिर्फ important topic करूं? Can you do entire surgery? It is like someone asking, सर चांद को छू के आऊं या बाहर तक होकर आऊं? भाई चांद को तो नहीं छू सकते, बाहर तक क्यों होके आ सकते हो? So be practical. You know the 90% answers yourself, but if you need any assistance or any personalized thing, we are always there. Not just sir and myself, the entire team of DocTutorials is there. Suppose you are having a problem in pharmacology or surgery or medicine or pathology or dermatology, anything, feel free to ask us, and I'm quite sure the faculty will definitely reply to you, irrespective of the fact that whether you are a DocTutorial student or not. So we are there, but ladai aapki hai. So fight well. We are there.
All the
Thank you
best,
so much.
guys. All the best. All the best. Thank you very much.